So what was important for me to point out, we mentioned that genitalia is for now less relevant for this course as far as like treating and assessing pelvic floor dysfunction. What is relevant and what is something that can change throughout our life is the bone structure that we are born with. So the pelvic bone of a male individual does look different than the bone structure of a female individual. So what we can see as far as differences, I'm very talented in drawing, as you can see. So I drew a beautiful picture of two pelvises. So this is resembling the male pelvis. Okay, so what we can see here, the differences in the shape of the pelvic inlet. So the pelvic inlet is literally where we are letting things into the pelvis. Okay, so that's coming here from the top. So when you look from the top, the pelvic inlet is the superior opening of the pelvic bowl. Okay, so the pelvic inlet looks different in men and in women. The pelvic inlet shape in a man is more heart-shaped. Okay, so it's more narrow. Versus in a female pelvis, the inlet is more round and the pelvic shape itself is more open and flat to be able to accommodate during pregnancy, to carry a child. But then also we can see that the main function the female pelvis has adapted to is pregnancy and childbirth. As we can see amazing adaptations happening throughout the pelvic bones, even throughout pregnancy and childbirth. So another difference is the thicker bone structure that we see in a male pelvis versus the bone structure in a female pelvis. The bones themselves are thinner for the female than they are for the male. Talking about the ability for a female pelvis to birth a baby, we talk about adaptations that go beyond the wider pelvic inlet, looking down through the area where we find the tailbone. Okay, so we're looking from the top into the pelvic bowl. This is the pelvic inlet. In the female, we see here, this is obviously a female pelvis, so we have more a round aperture of the pelvic inlet. And then we can see here the tailbone, okay, when we go straight inside. So imagining a baby moving through the pelvic inlet on its way through the pelvic outlet, the tailbone is in the way. So nature has a great adaptation for the tailbone in the female. So the tailbone is actually flexible. So when the hormones of the pregnancy are present, they are helping to soften the tissue and they will cause the tailbone to be flexible. So once the baby is passing through, everything will just go out of the way. Okay, so the bones are designed in the female to allow for more movement. So the whole pelvis will become movable. Okay, so this will become soft, where we talked about the pubic bone. The tailbone itself will become flexible and will move out of the way. The sitting bones themselves, when all of this is widening and opening, will move out of the way and open the pelvic outlet as well in the second stage of the birth. Okay, so first pelvic inlet, then pelvic outlet, and the tailbone is flexible as well. So another tiny pelvis I brought. I have a collection of many, many pelvises, so this is one of them. This pelvis just shows us the potential that we're having in the female pelvis for all of those movements. So you can see here when I'm moving this around, obviously it's very exaggerated. This is not how much mobility there is in a female pelvis. But this shows us if the baby is on top, the first stage of the birth, the superior, the inlet of the pelvis will be opened. And then after the baby is passing through and continuing on its way through the birth canal, the inferior opening, the pelvic outlet, will become flexible. You can see here the tailbone can move actually backwards. So we can open all of this into these directions, okay? So that is important for us to know in the post-natal period, as we talk about mothers recovering from birth. This is what happened. Their pelvis moved. Everything has moved. Our body is designed to rehabilitate to this, for the bones to come back together again in their place. But there is certain injuries that can occur during giving birth. If, for example, the mobility of the tailbone is impaired, if the tailbone is very stiff, and we will talk about it further on, that the pelvic floor muscles is attaching to the tailbone, to the sitting bones, and to the pubic bone in this area. So if the pelvic floor is too tight and does not let the tailbone open up as it should, it could cause injury to the pelvic floor, but also to the bony structures. And further on, we need to focus on strengthening the area again and helping the pelvis to return to its original place. On top of the changes we already talked about, we can also see a more narrow angle in the pubic rami in the front. So we can see a more narrow angle in the front in the male pelvis than we can see in the female pelvis, which is again due to the ability of the female pelvis to accommodate and to carry through pregnancy and birth, versus the male pelvis is more built for a heavier body build for carrying higher loads, so that we can see that reflected in the male pelvis as well. The male tailbone is more tucked in and is stiffer. So that is also important for us if we talk about male pelvic pain. There is many patients who suffer from tailbone pain as well, from the attachments of the pelvic floor, which we'll be further exploring on the tailbone, which can pull the tailbone in this fixated position and cause pain in this area. So the male pelvis also needs a lot of mobility and needs to move a lot because in its shape, it's already very stable. So we can definitely encourage also our male patients to engage in more mobility of the pelvis, which can be a challenge, but we're trying to provide the knowledge to make this point very clear.